Hi, this is Dr. Varisa Perlman with Petite, Crème. We're here with our podcast, Beyond the Diaper. And for this edition, I have the wonderful Paige Williams-White, who was a brilliant nurse practitioner and a patient of mine at some point when we were in Miami. It's a really good time for us to have conversations about medical issues within the context of parenthood and self-care. So you're going to see us kind of touch on a lot of different topics. Our topic for today's podcast is the ever popular poop, basically. So
it's one of my favorite topics.
Yeah. So Paige has young children. I have older children, but the thing that unites all parents is understanding and struggling and sometimes being very frustrated by a basic human function of poop. And the thing I think that is very difficult, it's actually a big part of Chinese medicine, is to understand your poop. And so being able to understand how important knowing what poop is supposed to be like and like when it changes and what it means when it changes, I think really answers a lot of parent questions that come up. So it does tell you a little bit about how a child or a person is thriving, is eating, if they're sick. So let's go a little bit into that. So let's talk about the first poops from the very beginning. We're going to go through the first year. So when they first are born, what's your thought on what poop looks like? What kind of got you when you had your kids?
Oh, so the first go around.
Yes.
That first poop, that black, like very dark looking poop. And I think that catches most parents by surprise, obviously. We're like, is everything okay down here? So
right?
That's the first one. And all the,
yes.
Everyone comes in and that's when the nurses come in and remind you, no, this is exactly what we want to see and everything's okay.
Yes. It's basically debris that's in the gut for the first 9 or 10 months. So that's why it looks so weird. It looks like tar coming out.
Yep.
And a lot of times, when it's coming out, it's hard for it to pass. It's sticky, it's gooey. So it's something that all parents are warned about. You should not see black poop later on, any point past that beginning moment, right? And if you do, that is an emergency, and we'll go into that later. But in that very beginning, seeing that black tarry poop can be very unsettling. La Petite Crème, it's a wiping lotion. Great to bring that when you go to the hospital because the oils of the olive oil will actually pick up some of the oils of the tarriness that's in the meconium and it wipes easily.
You won't have to wipe as hard. I was just going to say, I wish I had that product. Honestly, I wish I had that when I had my children in the hospital because especially on that newborn, new skin, the way that you need to wipe already, you feel so bad. So I 100% agree. If I had that product while I was in the hospital, I feel like, it would just be a lot more gentle.
Yes. And it just doesn't, it's so hard to pull off the skin that you want something to help pull that off. So that's the meconium. Pretty quickly after, though, it starts to change, right?
Yep.
So the next color is, what's the next color you remember seeing?
Mustardish.
So that's the good part. Yeah, that's the good part. I find that there's an in-between, interestingly, and depending if you're breast or bottle fed.
Yes,
so like
that's true.
In the beginning, right? So in the beginning, you have the meconium, and then after that, you kind of go into a green. Maybe it's a little too much information, but you go into like the green, right?
That's true.
You go into the brown, and then especially if they're breastfed, you're going to see this yellow CD. Now, sometimes when you're fed formula, you'll stay in that green, and that's okay too, right? A couple things is that you don't really want to see blood streaks, right?
Yes.
Blood streaks will mean one of kind of two things. One is that there's a sensitivity maybe to a milk product in either the formula or in the breast milk. So sometimes the mother has to take a little bit of the dairy out of their diet, maybe some of the sugar, or they have to change a formula, okay? Or if it's been really hard or whatnot, It's going to be, a little bit of like a fissure or whatnot that might be there when they're pooping, that you pull a little bit of that blood. What we obviously don't want to see are big mucusy poops, because that tells you that there's an absorption issue. And you also don't want to see balls, right? You kind of want to see, I like to say, the consistency of like creamy peanut butter.
That's a good one.
Yeah. I hope I haven't destroyed peanut butter for many people, but creamy peanut butter is kind of like the best consistency because it kind of goes through. Sometimes it will be looser, and it is not uncommon while the gut is learning how to do its business and absorbing correctly, and working and modulating and pushing things through at the right timing, because that nervous system that's around that gut is still developing.
Exactly.
So you want to be able to kind of make it pretty loose. Whereas if it's little balls or really formed, the body, the gut at that age really has trouble pushing that out.
Exactly.
Right. So the other thing that's important, especially in that first week of life, is that all of that poop and the color of the poop, along with the pee, is how you get rid of the bilirubin that is in the bloodstream. And so practitioners, doctors will be very, very keen on you keeping track of how many poops you've had within like a 24-hour period, because it really is the way that you get rid of the bilirubin, because the bilirubin in your bloodstream when you're an infant, because you've got a lot of breakdown of a lot of red blood cells, is quite high. So it is the job of the pee and the poop to kind of get all of that bilirubin excreted, because that's what gives it the color. And then as it goes down out of in the pee and the poop, the levels in the bloodstream will go down. It peaks around day 5, and it should be getting better. But if it starts to kind of if it's not being excreted properly, you're going to see that bilirubin continue to go higher, and that can be dangerous to the brain. So every day, everyone's going to be like, pee, poop, pee, poop, pee, poop. They're going to want to know that.
Yep.
Right? Which is frustrating, because I know you breastfed, right? Is that sometimes the milk isn't really coming in immediately. So we're hoping.
I've had bilirubin issues with my children, especially my second one. We ended up having to stay a little bit longer to monitor. And it was that exact thing, we're tracking the pees, the poops. And for me, yes, I breastfed, but I had to document exactly, the timing that I breastfed, how long that they were on the breast, things like that.
Yeah.
And it's frustrating, and it can be a little annoying, but, at the end of the day, it is most important for the child.
So important.
It makes you almost, in a weird way, obsessed. Like, did they poop? Did it happen?
Absolutely. Absolutely.
But, it's also kind of cool to see it go down. And, in the hospital, they're checking those labs every so often.
It's a function.
And I remember, everyone has the app on their phone to see the levels. So, I'm watching them poop so much. And then I'm looking at the level as soon as, the notification comes up. And when you see it go down, you see how it works hand in hand.
It does. It does. And I think that's where, in the very beginning, when you're giving birth and you're just trying to recuperate, everyone's like, take more fluids, take more fluids, take more fluids. Because when you do that, it actually makes, there's a volume game, right? It's not just the nutrition, but it's the volume of milk that's coming through that will kind of get what they call a gastrocolic reflex, and get things that land in the belly will stimulate the bowels to move. Exactly. Whereas if you're just kind of feeding here and there and they're not getting the volume, you're going to have a lot of that poop kind of sitting and not getting rid of the bilirubin, right? So it's really a volume question in many ways. And if you're not peeing and pooping very much and the bilirubin is getting higher, they'll have you obviously try to feed more frequently. They may supplement, they may pull the volume in there in order to try to get rid of the bilirubin, along with maybe some bilirubin lights. So that's already, right? From the first week, you can see poop becomes the center of our thought. So Chinese medicine was right. It is important.
Always is.
But so the sooner you're okay with that, the better, right? To kind of know that. Yeah, just don't fight it. It is what it is, right? So moving along, as you go to like maybe a 4-month-old to a 6-month-old, they're probably, hopefully, pooping very well on either breast milk or formula. But now we start to introduce some solid food.
That's the stage I'm in right now.
Okay.
And our poop has greatly changed.
Tell me, what are you seeing? You're on the front lines. What are you
So
seeing?
we have changed from that yellow consistency to more. It's more formed. It's not hard yet though, but it
Yes.
is. I guess a little bit more. What are the different types of peanut butter? There's the soft one. We don't eat
There
peanut
you
butter in
go.
my house, but it
Yeah, good.
changed
Yes.
to the more
Yes.
chunky. There it is.
Chunky,
We're now at a chunky peanut butter.
right?
The
And I'll
color
take chunky peanut butter. I love that. Yes. I'll take it.
The color definitely varies with what we're eating sometimes.
Right.
So I
Right.
also like to tell parents, don't get so scared when you see a color change as well. They might have eaten something
Hmm.
different. We talked about in
Yeah.
the beginning, things to be worried about. If we see blood in there, things like that.
Yes.
A
Yes.
color change one day, I think yesterday we
Right.
had a light brown. The day before that, we had a little bit of green in there, but we had some peas that day.
Yeah. Yeah.
you
It's
know,
all related.
it's fun
It's
now.
all connected. It's corrected. And I mean, listen, I mean, if your poop loses all color, if it becomes white, that's a concern that there's an
Yes.
issue with the liver. But color and the variation of the colors and the consistency, that's okay. We like that variation. We just don't want it to be little pebbles
Exactly.
because it's counterintuitive because you think, oh, but they're smaller, they should be easier to pass. And that is just not the way that the colon works. It
Still more
really
soft.
needs bulk in order to move it through. And so people will come to me and say, "Oh my God, how is it that this little baby has so much stuff coming out of it?" And I'm like, "I like the stuff. I like a lot of the stuff, right?" It makes me very nervous when they're pushing, 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 and a little ball rolls out. And I'm like, we're stuck. We're
Yeah.
stuck. So we need fiber. And the problem with the colon is that the longer that things are kept there and
Mm-hmm.
they're not moved through, it absorbs liquid from it. So something that starts like this just gets smaller and smaller. And that's why you end up with that ball. So there's a phrase that will make more sense later on, but I love the phrase because it just helps me is fluffy, happy poop, right? So I need a fluff to it. I need a little something to it. I don't want them to be sad or crying when they're straining, right? And those are two elements that I think are so important. And it becomes even more important. And as you go into like 9 months, now they're actually eating more food. There are some foods that do constipate, bananas, for some people, apples, bananas, apple, the brat diet, basically. So when you're having diarrhea, we'll ask you to eat more bananas, rice, apples, toast. But it can work in the reverse that if you're actually already a
Yeah.
little bit constipated, it can constipate you more.
Mm-hmm.
So I'm always like, you can have these foods, but also pair it with a pear, right? Pea foods, pears, prunes, peaches, papayas, pitaya. There's like a lot of these things that for some reason, peas, unfortunately, I think for some people can constipate. So you kind of have to do a little trial and error. But what you'll see is that, we're not trying to tell you not to eat all those kinds of foods, but maybe like don't eat a banana
On top of
sandwich, like on a day when they're already kind of getting thick. You just want them nice and loose in that passing. So we move on to 9 and 10 months, and then you go into 12 months. And like sometimes we don't train until maybe 18 months to 2 years. But we're starting to make the conversation, right? So toilet training is where this constipation discussion becomes of the essence, right? So you have kids who are also toddlers.
Yes.
Tell me a little bit about what that training experience looks like.
So it's funny. My now 3 year old, when it was time to start the toilet training, she actually, and this is pretty common. She was afraid of her poop. She would see it and it would scare her. And it did have a little bit of a negative effect in the beginning. Obviously, they hold it
Yeah.
in. So
Yes.
that was a big thing we had to do, and we did some of the toilet training where after we eat, a little break in between,
Good.
but we would sit
Yeah, right.
down,
The timing. Yeah,
make
yeah.
it a more relaxing experience, and then it would come. Not every time, but I tried to make it a regular thing so that it wasn't
Hmm.
so easy for her to just walk around and hold it in until it wasn't a problem
Yes.
anymore. But that definitely
Yes.
helped us. That definitely helped.
Yes. I love that you brought that up because people don't realize that your body's actually meant to really, there is a timing to it. And usually it's the morning, but it can be at different times. But what you don't realize is that your kind of mental status will affect whether or not you will pass a bowel movement. People who are running from a tiger are not going to be worried that they're going to pass a poop because their body is getting an incredible sympathetic surge and it literally shuts down, right? The whole body. And it's like, I'm not going to pee, I'm not going to poop, run. Like, just run. Let's not ask questions. The problem is that in modern day times, thankfully, we don't have tigers chasing us, but we have, come on, let's go. We got to go now. Why are you doing? What are you waiting? What are you doing? Are you going to come to, right?
Exactly.
That is pretty much like a tiger.
Yeah.
So if you set that time for your kid to poop, but it's at a time where there isn't that, right? They're not calm. You're kind of shooting your foot, right? Shooting yourself in the foot because it's just not going to work. So I think that's great to give some mindfulness because we all talk about putting the potty in the room. You know, we talk all about getting the books in ready. You know, like we talk about, but we don't talk about what section of your day is it where you can give them that space to kind of relax, sit in their body, not be chased by a tiger, and pass a bowel movement. So I talk a lot about when do you know that they're ready to toilet train, right? And there's some that train actually very early, and then there's some that train a little bit later. But the way that I like to assess it is that fluffy, happy poop, and then lots of speech, right? Because they do need to kind of say to you, I want to go, or I don't want to go, or maybe I'll soon want to go, or I just went, right? There's like a little bit of that needs to be there, and lots of interest. If they don't have interest, you can't force this. And so you force it, you make it a kind of reward and punishment system without realizing it. So it doesn't really work that well, right? So I like to I like to kind of like make the assessment before you make the effort.
Exactly.
Because you're going to find yourself very frustrated if it doesn't seem to go and you yelling at them, guess what? You became a tiger.
Yep.
So no need to make yourself a tiger, and they're holding it. So let's talk about, so when it's not fluffy, happy, when they're not ready, and they're doing well, but all of a sudden they have a day where maybe they didn't drink enough water, ate a little bit too much ice cream that day, like just like didn't eat that apple, or apples. I find some people it actually works, but you didn't eat the pear or the fruit that you wanted them to eat, and now they're straining. And people get so frustrated with the fact that their kids became constipated and they're withholding.
Yes.
They will tell me they're withholding, but I don't understand because they're having accidents. So it's going through. I don't know if you had the wonderful experience of having this happen.
Yes.
Tell me what you're seeing.
Okay. So 2 things. And I always have real life examples for these. Not my own kids, but, my family, we all help each other out with each other's kids. And I have a specific nephew that I used to help take care of. And it did become a problem. There were other factors. The diet wasn't the best. He did not drink water. He loved all the junk food, things like that. And, my sister finally brought it to my attention that she was getting so frustrated because she was seeing the streaks.
The streaks.
In the underwear. And, he's getting older and she's, I just don't understand, like, why he just can't go. And, then it became a negative experience on top of that. And then he's embarrassed. And then, so, it just, and then it builds up into this whole cycle. What we ended up doing, and also, there's a timing for medications and things like that. And I know we'll touch on that as well.
Yeah, we're going to talk about that.
It's funny, we had to take hold of the situation and look at the entire picture. And, I had him for a few weeks and we revamped the diet, the consumption during the day, the experience of pooping, essentially. And it got 10,000 times better.
Yes. So the streaks, why the streaks, right? Because they're like, but they're pooping. It's not really pooping. So what ends up happening is that in that colon, that big chunk that has just like that boulder
Right
that's
there.
sitting in there, is sitting, it's not passing, right? So what ends up happening is that there's runoff around the boulder. And so they don't feel it. It's not their fault. You cannot yell at them because what's happening is that it's just running off. And that's why it shows up as a streak as opposed to like pieces. Another not awesome thing is that as that piece gets bigger or like the more mass that's stuck in that rectal area, it stretches the nerves around it. So that sensation to go doesn't really happen anymore.
Exactly.
Okay. So another thing that happens that's not really their fault, right? So these accidents are happening and they feel badly about it as a parent who wants to clean underwear that has poop on it. So it's like everyone's really frustrated, right? Right. So in many ways, there has to be a pause. And I love that you brought out, so twice now, this is because you've lived it, right? Because we can throw advice around and we can throw money, throw medicine at things. But in the end, everything goes back to shifting parts of your day. So the one you mentioned before was finding a time that's nice and calm where they can comfortably sit and, not for a long time, but they can know that that's a time where they won't be yelled at, that they can go. And then they have their bowel movement and we go along to the rest of our day, right? People want to have quick fixes. That's a very Western idea of things. I like to think of it as a two-prong effect because you are correct that they actually do need to start going. So maybe they're so stopped up, they even need an enema, right? They need to clear the vault, right? So some may need an enema, okay? They have pediatric ones, so it is what it is.
Yeah.
And then you need to clear all of it. So say you don't need an enema because they are going, but it's chunky and they're not really evacuating. People don't love Miralax, but in a set period of time, it can be useful.
Yes.
And then most people just stop there and they're like, fixed.
Exactly.
Because Miralax will get them to go once a day, once every other day, but they'll start going. And everyone will be, oh, this is great. I fixed it. And then guess what? They try to come off of Miralax after 2 weeks. And we're back where we are. And they're like, how did that happen? That happens because we haven't fixed what's coming down the pipe, right? We're only fixing what the end of the pipe looks like. We're not really helping what's coming down.
Exactly.
And those things that you talked about, and it may affect many pieces of the day. It may mean that you might need to eat home more often. It may mean that you need to cook. It may mean that you may need to be like, did you drink that water? Did you drink that? I would give you another water to drink, right? It affects the family. It affects the dynamics.
It does.
Sorry,
it's not
it
the
does.
Quick fix. It's not the quick fix that people want it to be. And, again, I understand that it's not easy. I understand. I have 3 children. Trust me. I understand that it's not easy, but it does end up making it easier in the long run. It does.
Right.
The giving the medications, like you said, it does fix the issue. And I do believe there are plenty of patients that I've seen come through the urgent care where I'm like, oh, this kid needs an enema. Like, this is the time.
That's right.
I do like to make sure that visit ends with, okay, let's talk about how we got here.
Yes.
Let's talk about it so that we don't have you come right back in, 2 weeks from now and have to go through this again.
And what I say is that the Miralax is just buying time. All it's doing is just buying time so that you can get all of your affairs in order, get your diet in order, get your water in order, right? Your timing. And so that when you kind of finish the 2-week block, I don't really recommend just dropping Miralax. I'm like, do the 2 weeks and then maybe make it every other day, kind of work with it to kind of go down a little bit. But what you'll find is that once you take off whatever it is that's helping you go on the acute level, that the changes that you've made will make it more likely that on a long game, that their poop will return to consistency. Now, does that mean that you're going to have to check every poop that they have after? Yeah, for a while, because you need to know if it's working, okay? And the problem is that a lot of times that age, they're not great at wiping. and you don't know what's going on, and it can be very irritating to have the poop there. They might get hemorrhoids, which are actually very painful to touch. So this is another time using La Petite Crème in a toddler level I love, where you just take a little bit of toilet paper, you squeeze a little bit of the La Petite Crème on there, and what that does is that it allows it to be kind of smooth like a wipe, but also repair the tissue that might be irritated by wiping that didn't really go well in the past, right? So you're correcting the past and also preventing in the future. So it's kind of a good twofer for one there, and it doesn't hurt them because when you have hemorrhoids and you touch them with a dry piece of something, it's raw, it hurts. So this actually will soothe the area. So I had a toddler who was using it, and she would yell to her mom from the bathroom, "I need my booty cream." So she knew. She's like, it's going to be feeling good very soon. And so I'd like to, for your kids to channel, like, booty cream is coming. Wipe with it, especially when you have that toddler, because they get a much better wipe. And physically, it's not that easy for toddlers to get to where they need to get to. And so literally giving them something that gives them a little extra wipe when they do it is a great idea. Exactly. So wiping with that on a kind of like a hemorrhoidy thing, but being a two-prong effect where you clear out what's in there and you make sure what's coming down is nice and loose and kind of easy to absorb, and like gives them all that fiber that like carries the rest of it, can make the whole constipation withholding game. Because you have to convince them it's not going to hurt. They're not dumb. They're brilliant. And they're like, it hurt. I'm not going to do it anymore. So I'm going to dance around. What they don't realize is that when they keep doing that, it just funks out that whole area. And now they can't even feel it when they have to go.
Exactly.
So that is a big problem. But I find that after the toddlerdom, the other piece I want to touch on too, last, is that constipation, irritable bowel is hereditary. Sure. And what I find very fascinating is that whenever I have a discussion about it, I will ask very forwardly, who is it?
Yep. And even 9 times out of 10, someone is saying they get it from me. Almost before you even have to ask. Yeah, I have it too.
Because all the things that we talk about, I'm like, maybe you should do it too. Because it is a lifelong thing. And I find so many adults are walking around with really bad constipation, and they're like, I just deal with it. I just sit on the toilet for an hour and a half every day. No, I actually saw someone, a GI doctor, who she was like, it should take like a minute and a half to like go poop. Like it should be like sit, poop, off. So if you're sitting there for an hour and a half every day trying to have a bowel movement, chances are good stuff is not coming through you.
Exactly. And it is, unfortunately, I know I keep bringing it back to this, but it's a lifestyle change coming from coming from a person with children who do have only one of them so far has the constipation issue. And in our family, when you ask who it comes from, unfortunately, I have to raise my hand. Okay? All right. Definitely, I am the one.
There's always one.
And my husband loves to say it's her. And it's funny because my husband is a GI doctor.
Yeah, so you married the right guy.
I absolutely did.
He will not let you get over it.
But what I can say, and this is funny, I am a constipation survivor, right? I can say because the issue is gone. It's gone. And it is not just from my husband putting me on the Miralax for 2 weeks. It's not from that. And, I had a lot of trauma from it as a child.
Totally.
My parents are Jamaican, and they're also obsessed with poop and making sure that there's a constant bowel.
That's right.
And the things that had to go into it to get me going as a child, there was some trauma behind it. And then leading into growing up. And now that I have learned more, obviously I went through nursing school, and even in nursing school, I'm learning these things. I'm like, oh my goodness, I've been doing life all wrong.
Right. Absolutely. Absolutely.
But now I learned my body, and not all things that work for other people as far as food consumption may not work for me. Some things that they say should
Yes.
help me go don't always, but now that I have gone through
Yes.
that trial and error and figuring it out,
Yes.
life
So
is
tell
better.
me, yeah, so let's leave with, what are your favorite foods that you think, or favorite habits that you do that you think help you?
So the biggest one is not even a food. The biggest one for me was being hydrated. I was not well hydrated at all. Water, water,
1,000%.
water, water, water. I was
Yeah.
not a big water drinker growing up. I loved juice. Probably a huge
Okay.
part of my issue. It was that probably was a huge
Yes.
part. Now
Yeah.
I drink a lot of water and
Good.
I work out every morning. And
That's a
that has been
great
a
point.
huge game changer for me as
Yes.
well.
Yes.
Apples are a great thing for me. My body loves the
Yes.
apples.
Yes. Yes.
Pears are a great thing for me.
Yes.
I do not like prunes. I couldn't do it. I don't
No.
like prune juice. I can't do it. So
Yeah.
I had to
Yeah.
find other ways. But
Yeah.
those are two, foods that I know I can consume and
Yes.
I'm great. My husband, the
Yes.
GI doc, pushes this kiwi thing. Kiwi,
Yeah. He
Paige,
loves
I'm
the
telling you,
kiwis.
you have to,
Yeah.
this is what you need to
Right.
do. I haven't
Right. Right.
personally tried it, but I know some people say that works
Sure.
wonders.
Yeah.
But those are
Yeah.
just a few things lifestyle wise that now I can't tell you the
Yes.
last time I've had to take Miralax. I
Right.
genuinely cannot tell you. Maybe
Right.
during pregnancy, but
Yes.
outside of that, you know?
Yeah.
So I think lifestyle changes are a huge thing. I don't know if you have other things that maybe you tell your
Yeah.
parents to try
Yeah.
out with their
I've
kids.
seen. Yeah, I think that I'm gonna blame my husband. My husband is that, so we'll just blame it. But exercise and walking. A lot of people say that after a meal, it's really good to walk. Besides digestion and in decreasing your blood sugar, actually, it's actually very good. Your insulin works a lot better when you walk or exercise after eating. But a lot of people find that that stimulates the bowels, right? So, like, if you're too sedentary and your kids just sitting around all the time,
Exactly.
they will more likely get constipated. I love the water. I think people lose track of how hot it is outside. You, I know, live in Orlando, but it's going into summer. So a lot of that hydration can be a big deal. I love this idea of finding the foods that work for you and eating them on a regular basis. I think that we spend too much time, frankly,
Mm-hmm.
trying to say, am I craving it? Do I feel like it tastes good? You should eat food as medicine. Maybe not all of it, but for me, I am a big fan. So I start the morning, and the things that are kind of strange are like legumes and cabbage are fantastic. And so I start the morning with some brown rice, which I actually like more than white rice.
Yep.
And I'll do a
Same.
brown rice. I like to eat with salmon, and I'll have like cabbage or some form of cabbage, and a little bit of like pickled chickpeas with it. Strange breakfast. It's very strange, right? But I eat that combination of things because then I know, check, I've gotten my fiber, right? I've gotten my legumes. And then I definitely eat one apple and one pear every day.
Nice.
It sounds weird. I'm not always
No.
craving it. I don't always feel like it. But to me, I would much rather eat those things on a regular basis. If you ask someone who's 85 years old, God bless, they'll name you off like 10 things that they do religiously
Yes.
every day just to feel good.
Yep.
And it's just not, people will be like, well, what if I don't feel like it? I'm like, I don't care if you feel like it. Like,
Yeah.
do you want to
Yeah.
poop? Eat that. So it's
Exactly.
that kind of thing that with your kids, yes, there's foods that they like, the foods that they feel like, but when you are able to see food as a medicine
Mm-hmm.
that you need to take every day in order to avoid the medicine, you start to understand a little bit about health.
Yep.
Health is not supposed to be a sprint. Health is a marathon at its best. So an everyday thing that you do is so much more effective than doing nothing that helps your gut and then trying to jump in at the end and rescue it.
Exactly. And a quick thing for, especially parents, because I think that's a big thing. My kid doesn't like that, or my kid won't eat it, or my kid, they come in and they go for the other snacks. They don't want the fruits or the other
Yeah, yeah,
things that will
yeah.
help them. I have changed my life this year with my three kids. And now I prep before pickup. So for me, I am making sure all the things that I want them to consume, I have a nice platter. I make it look fun. Everything is out for them on the table. So as soon as they come in, they're, oh, food. And guess what's on that platter? All the foods that I want them to eat. There's apples on there. Sometimes I have the little crackers with the, with the cheese on there. But it's all the things, the chips are not out. The muffins are not out. All of those things. They see it and they're great. Let's go. The water bottles are already filled with ice cold water. Because, they've been out all day. They were at the playground. It's hot outside.
No.
And they sprint to the food. And in my mind, I'm like, check. We're good.
Right? And what you caught there, and I think that that's a really good point, especially with kids, is that when they go to school, lunch is kind of like a wash. I don't even know if they really eat that much. We're not in France. If we were in France, I would have confidence. My children are eating a well-balanced meal. But in the 20 minutes that they're allowed to eat, by the time they figure out how to open their bag, you're just, it's like, it's over, right? So I would actually pick up my kids because I found that if I just brought them home and started prepping, they literally would ransack the pantry.
It's too late.
I think my kid once ate 20 Go-Gurts and like pooped green for like 2 weeks. I was like, I don't know what raccoon like ravaged my hamper. It was too late. So what I decided, I would drive them to like a little cafe where we could get like a soup. We could get like a little sandwich. Something that was a kind of, I knew would be that they were ready for. And then when they came home, we would rest and we would still have dinner later. But it was almost understanding that that was their vulnerable point. That was the point where they were the most likely to eat something that they may like poo-poo. I was in Miami. We were and beans were everywhere, which is not native to like something that Asian families would eat. I found beans to be just a wonderful resource. So I had an abuela that was like sitting there with a kid after school and was just feeding them like black beans, And I was just like, okay, right? You got your beans. So find foods that work. Find foods that work for your kids. Find a time where they're most willing to eat those on a regular basis. Invest in that poop bank and you will be paid off, and then we don't have to do with the withholding. We don't have to do this Enemas. We don't have to do these things. But if you don't on a daily basis invest in that poop bank, the withholding happens.
And it's just a cyclic effect. So
break the cycle. Well, thank you. Wonderful talk as usual. Thank you, Paige. It was wonderful.
Thank you so much for having me on one of my favorite topics.
Who knew? Who knew? All right. We'll see you next time.
All righty.
Bye.